Hi, my name is Brandon Kerr, and this is my audience. Today, I'm going to inform you about Wellness tumor. Hopefully, this speech will increase awareness and open a few people's eyes that are new to this subject. This is a very important matter of discussion to me, and this is why. This is a picture of a 3-year-old child recently diagnosed with Wellness tumor or nephroblastoma. This is a disease that occurs most commonly in young children and infants around 3 to 4 years of age, but some as young as newborns. Wellness tumor is much like other cancers in that its definition is a mass of cells that grows out of control into what we know as a tumor. In the Wellness tumor case, this begins in the womb, and if the young fetal kidney cells fail to grow into mature kidney cells by the age of 3 or 4, there is a chance that these same cells will continue to divide and grow uncontrollably into what we know as a tumor. The Wellness tumor is named after German surgeon Max Wellms. He was the first doctor to publish anything on this subject back in 1899. According to LifeScript.com, this tragic disease has a frequency of about 1 in every 200 to 250,000 children. The highest risk factors for this disease include having a parent or a close relative with the same disorder. This genetic factor greatly increases the chances and should be made a priority of regularly maintaining and checking the kidneys until becoming an adult. Generally, the first visual symptom is, as with the girl in the picture, a lump or mass protruding from the kidney area. Stomach, abdomen, and back pain are all associated with this as well. Fever, loss of appetite, and nausea and vomiting are common symptoms also. As with many other cancers, this particular case came as quite an unwelcome surprise. Currently living in Indiana, this child and her parents were down here on vacation in Florida. Complaining of her back hurting and crying out in pain, this still was not made a concern until arriving in Indiana once again. Attending her brother's baseball game, she became very ill and began vomiting and having sharp abdominal and back pain. After the doctor had been notified, they showed up immediately only to find out the worst. The primary pediatrician had been out that day and an on-call doctor had been seen instead. Upon examination, the doctor stated that he could feel the mass inside by the kidneys. Fearing the worst, she was then rushed to Riley's Children's Hospital by ambulance. Upon arrival, she headed straight to the CT scan machine, and after that, blood work. 10 hours passed of only tests, heart monitors, needles, x-rays, and all that at 3 years old. Once the result of the CT scan came back, the doctor had news nobody was prepared to hear. The tumor was so large that they would have to wait at least 6 months before any kind of surgery decisions would be made. It turns out that the tumor was roughly the size of a grapefruit. Months of chemo and radiation therapy ensued. This little girl, barely having a glimpse of the world, had been considered a stage 4 terminal patient. Soon after surgery, when she was feeling up and okay, she and her family took a plane trip all the way to Hawaii as part of the Make-A-Wish Foundation. There, she swam with dolphins and experienced happiness and felt good about everything for the first time in months. According to eMedicine.com, Wellness tumor is the 5th most common pediatric malignancy and the most common type of renal tumor in children. Without the use of the modern radiation and chemotherapy treatments, 60 years ago, the survival rate of just the nephrectomy, or removal of the kidneys, was 20%. Now, about 9 out of the 10 children survive at least 5 years after their treatments. Though it is rare, only 6% of every 500 cases diagnosed each year involve both kidneys. This would be considered a stage 5. This girl that I have told you about has made it much past the surgeries. She has made it much past the treatments, and as of being 6 years old, she was deemed in remission. She still has to get checkups on her kidneys every now and then, but is in great health due to the care that she received at Riley's Children's Hospital. She's currently 19 years old, and this is how she's doing now. This girl that I have told you about is my girlfriend. I hope that this story and these facts have made you just realize how precious life is. She inspires me every day to live life to its fullest and to never turn back on anything I do. I trust that you've gained some awakening with all of this, and now you're aware of this tragic disease. As with any cancers, we all know that increasing knowledge and awareness is key to help figuring out causes and cures. Again, I hope this has touched you and helped communicate this affliction. Thank you.